Cardiac pacemakers are an implantable electronic device that is typically used to regulate cardiac rhythm. There are 7 different types of pacemaker that are available depending on the needs for the implant. At their basic level of function, they will prevent the heart from going too slow. So bradycardia is the term we use for that, and pacemakers are a very simple and elegant solution to prevent the heart from going too slow. There are other indications for pacemakers that can be for resynchronizing people's hearts when the pump function is reduced and they have certain other ECG criteria. And finally, the other type of pacemaker is when these devices act as defibrillators, where they have the ability to detect abnormal, life-threatening arrhythmias and can then deliver therapy to treat that from a patient's perspective. Pacemaker implants are typically done as a day case. They can take anything from 1 hour for the most simplest type of pacemaker to maybe 2.5 hours for the more complex types. They're all done with local anesthetic and a combination of sedation as well. Very rarely is it needed for people to have a general anesthetic. Pacemakers have 2 components to them. They have the battery component, which houses the generator of the pacemaker as well as the computer that controls things. And attached to that are wires that we pass from veins under the collarbone typically down into the heart and place them in different places of the heart depending on the function of the pacemaker that is desired. Once everything is satisfactory, these items are secured and connected, and the wounds are then typically closed with absorbable stitches. The wound is no more than about 2 inches long typically and sits just up here under the left collarbone. Once a pacemaker is implanted, there are some checks that we need to do later on that day, including a chest x-ray and an interrogation of the device. And if those are satisfactory, people are generally allowed to go home. Recovery after pacemaker implantation is mostly about the wound, so we don't want people doing anything too vigorous with their left arm, particularly above about 90 degrees at the shoulder, for maybe 6 weeks afterwards. All pacemakers will come with driving restrictions from the DVLA, and it will very much depend on which pacemaker has been implanted and why, so you would need to talk to us specifically about the implications for that. The devices will have batteries on them, and the batteries need to be monitored, and that is services that we will provide as well. Typically though, the batteries last anything from 7 to 12 years, depending on a variety of patient factors. Pacemaker implantation is generally considered to be a low-risk procedure. The most important risk that we care about is the risk of infection, because we are leaving some artificial device inside. So we take high levels of precautions against this, but the risks still are present, and that is around 1 in 100 cases, despite our best efforts, might get an infection. There will be bruising around the access site, but that's not normally a big problem. Other risks would include lead dislodgement. The wires that we have placed from the pacemaker into the heart, because the heart is obviously moving the entire time, these can dislodge and they may need to be repositioned. That typically will only occur 1 in 100 times as well. And finally, the other risk that we talk about is we need to access a vein typically under the collarbone, and so sometimes the lung will sit behind the vein and can be punctured with our needle, and this will create something called a pneumothorax, where the lung partially collapses. Not as dramatic as it sounds. Often the patient's completely unaware of this, but is partly one of the reasons we do a chest x-ray afterwards as well. This risk is no more than 1% as well in experienced centres.